So, hi friends. Finally, the network issue is solved. So, hi friends. I'm Dr. Anshul Bansal, joining you on this Unacademy platform today. In this session, as you all know, आज के एग्जाम के the recall NEET PG 2021 के orthopedics questions we'll discuss. Okay, so I hope you all are now relieved and examination सबका अच्छा हुआ होगा. The basic pattern, yeah, the basic feedback that I have got is that paper was of moderate difficulty, not very easy and not difficult. And जो भी questions थे किसी भी subject के वो सारे questions आपने पढ़े हुए थे. There was no such अलग सा कुछ भी. All were from the important topics of the respected subjects only, but only more emphasis was like on the x-rays, the slides, the image based questions, and more importantly the clinical scenarios. Majority of the questions were having clinical history, and they were of 4 to 5 lines, but very easy. And every question had one or two very specific hints pointing towards the diagnosis or pointing towards the answer. बस उसमें एक क्वेश्चन एक ऑप्शन was that which made you confused. Okay, so but उसमें ये था कि हमेशा जो मैंने आपको ट्रिक बोली थी अगर आपने वो यूज करी, दैट इज जो 2 या 3 आपको बेसिक चीज या बिल्कुल पैथोग्नोमिक फीचर्स मिलते हैं, उससे जो डायग्नोसिस होता है एक बहुत ही कॉमन सी बीमारी का, और द वेरी कॉमन थिंग दैट यू हैव स्टडीड इन दैट टॉपिक, दैट वाज द आंसर. एंड इन मोस्ट ऑफ द क्वेश्चन दैट वाज द आंसर. जिसने ज़्यादा दिमाग लगाया है और आड़े टेढ़े बहुत ही हाई फाई से डायग्नोसिस बनाए हैं, they have got their answers wrong. So let's start today's session. And before starting today's session, jaldi se I would guide you through a paid subscription plans that are available for NEET PG on Unacademy. The first one is the the plus subscription. Here you will get all the live and the recorded classes ka access, the access to a QBank, and you can compete in live tests and quizzes, all of which are found by the topmost faculty for NEET PG in India. And also we will allow you to log in with the same account on multiple devices so that you can log in to any device and you can study on any device at any time of your choice. And also for the subscribers who will be subscribing for 12 months or more, we will be providing them with printed notes. And while subscribing, you can use this code to get extra 10% off. The second one and the best one जो मेरी जुबान पे हमेशा रहता है, that is your iconic subscription. And it is best not only on Unacademy but on any digital platform across India. And what makes this best? Apart from the things that I have mentioned earlier, you will get the prep ladder and all of the prep ladder, including its Q banks, the video lectures, the quizzes, the grand test, the rapid revision, सब कुछ included होगा. And also on Unacademy extra में you will get well structured live batch wise classes, and the batches are formulated and the classes are formulated and made by us in such a way so as to build your basic concepts about that subject or topic first, then going into its in-depth and also correlating that topic with other subject अगर कहीं पे उसका name भी आया है, so that you can understand the concept and also you can revise very well, you can correlate. And also after every test you will be getting the individual assessment sheet, and you, so that you can analyze yourself, you can find out the topics or the subtopics or the subjects in which you need to work harder, so that you can plan your studies accordingly. And you can apply or subscribe for this iconic subscription using this code to get extra 10% off. And special classes होती है हमारे, and they are really very special due to two things. First of all, in this COVID time also, you will get live classroom like interaction where you can interact with your educators, solve your doubts there and there only. You can participate in polls, you will never miss a class, and you can just watch your class anywhere anytime by just logging to your mobile application. And the second thing is, this is an extra edge class. These classes will give you extra edge over your competitors in the examination, and for this you just need to download the Unacademy mobile application and subscribe using this code, both of which are absolutely free. Okay, so please go for the special classes. Okay, and keeping in mind the different sets of students who are preparing for different sets of examinations, like some are preparing for FMG, some for the next examination or the 2022 next or NEET PG examination. So for these we have started a dedicated batches, and you can use this code while subscribing for these courses to get extra 10% off. And we have started a FMG and the next 2022 batches from the 8th September. And we are also running a special limited time period offer, in which if you'll buy any plan of 12 months, you'll get 2 months of that subscription free, and 24 months pay 4 months free. And for our MBBS students, we have started a 4-year subscription package, in which the iconic subscription is available for just 75,000. It is a limited time period offer, and 75,000 for the entire 4 years. And the plus subscription for just 60,000 for the entire 4 years. Okay, and here is the rate list of a plus and the iconic subscriptions, and you can see the cost per month decreases significantly if you increase the duration of your course. So this is very important. First, economically it is very beneficial if you buy a plan with longer duration of months, and also secondly, your academics will be more stronger, because स्टार्टिंग से ही नेक्स्ट एग्जामिनेशन के लिए फ्रॉम द एमबीबीएस के स्टार्टिंग से यू नीड टू बी डेडिकेटेड टुवर्ड्स योर स्टडी, एंड वेरी इंपॉर्टेंटली एक रिलायबल ट्रस्टेड सोर्स ऑफ इंफॉर्मेशन और योर नोट्स शुड बी देयर, क्योंकि बार बार इफ यू चेंज it will be of no use to you. So starting से ही एक trusted source, and Unacademy is the best way, best digital platform for the NEET PG. So please go for subscription plans which have longer duration of your months, and you can use this code while subscribing to get extra 10% off. So up quickly we should start our session, that is about the recall questions of this year's NEET PG 2021. And एक और important बात, it's just recall from my sources and my colleagues or my juniors जिन्होंने इस बार examination दिया है. So if you have any doubts or any thing that you want to add on, या कोई भी आपको और question if you recall, or your recall framing of the question, please discuss with me with the live chat box and type it in the live chat box. Okay, so let's start. So एक question था with a history or the clinical scenario given like this: a patient after a roadside accident presented to the trauma center. He has a severe pain in his left hip, and on examination the hip is exquisitely tender with restricted range of motion. The affected limb of the patient is in flexion, adduction, and internal rotation. Which is the most likely diagnosis? Which is the most likely diagnosis? So here a clinical scenario was given, and first of all, hip pain, and there was this attitude of flexion, adduction, and internal rotation, all pointing towards the diagnosis of posterior dislocation of the hip. And it is very important, and we have discussed it several times, posterior dislocation of the hip. Okay, why not anterior? Anterior में posterior में anterior posterior ऐसे force लगता है, तो obviously the head of the femur will be dislocated posteriorly. So ऐसा attitude मिलेगा anterior dislocation में the attitude will be of extension, abduction and external rotation, and IT femur and the neck of femur were also given, and इसमें भी mostly the displacement is or the attitude is in the external rotation only. सो क्लासिकल क्वेश्चन था, ज़्यादा दिमाग भी नहीं लगाना था, ये पढ़ते ही पोस्टीरियर डिसलोकेशन ऑफ द हिप. बट सम स्टूडेंट्स आर सेइंग कि देयर वाज अ बिट कंफ्यूजन इन दिस क्वेश्चन इन दिस की हिप की इंजरी साइड जो थी वो हिप का था, एंड दिस एटीट्यूड वॉज ऑफ द राइट साइड. मतलब जिस साइड में हिप पेन था उसके ऑपोजिट साइड का एटीट्यूड दे रखा था, एंड देयर वाज सम रिलेटेड टू फ्लेक्शन डिफॉर्मिटी ऑफ दैट हिप. सो कुछ भी हो, इफ दिस इज गिवन with history of recent trauma and severe pain, you have to go to the for the posterior dislocation of the hip. Remember this thing. Okay, so here you can see this is your anterior dislocation. Okay, ये posterior नहीं है, anterior dislocation है, इसकी सब बाहर की तरफ है. Okay, now second question was the following test is done to assess with which nerve. Okay, so सबसे पहले very easy, it is your pen test used for the abductor pollicis brevis, एंड इसको जो सप्लाई करती है दैट इज योर मीडियन नर्व. ओके, इसको जो सप्लाई करती है दैट इज योर मीडियन नर्व. सो वेरी इजी क्वेश्चन, द आंसर वाज योर मीडियन नर्व. और ये कैसे चेक करते हैं? द abduction is like this, so you keep a pen like this. So normally if you the shoulder will be abducted, you can touch the pen like this. So this is your pen test, abductor pollicis brevis. Okay, ulnar nerve होती है तो ulnar nerve में you have the Froment sign, book वाला, you have the Igawa sign. In on anterior interosseous nerve you have this OK sign. Okay, so this pen test is characteristic test used to assess the median nerve. We have discussed the same image and the same question in a rapid revision and everywhere, so this was covered by us and very easy question. Okay, now the third question was also a clinical scenario and image based question where there was history given of a 5-year-old boy presenting to the OPD with complaint of chronic pain and bowing of the legs. Bone mineral density is normal. Then X-ray of the patient is shown below. Which is the most likely diagnosis? तो सबसे पहले 5-year-old boy है, chronic pain of the legs and bowing of the legs, bone mineral density is normal. X-ray here you can see there is calcification here, and this is a typical X-ray where you'll see this calcification here. Okay, this is your typical X-ray of the scurvy. Okay, with Menberger X-ray and all, and in scurvy एंड रिकेट्स इन दो में ही कंफ्यूजन होता है. सो रिकेट्स में इट विल बी पेनलेस, एंड इफ इट इज पेनफुल इट इज ऑफ दिस स्कर्वी. Very importantly, it is of the scurvy, and in scurvy the cartilage also have dense white जो कार्टिलेज होते हैं एक्सरे में वो डेंस वाइटिश फॉर्म में दिखते हैं स्कर्वी के अंदर, एंड इट इज पेनफुल. सो पेन आते ही वेरी इंपॉर्टेंटली द पेन अगर हिस्ट्री में दे रखा है विथ सच टाइप ऑफ एक्सरे इमेज and history, then the diagnosis is towards the scurvy. Very important, and it was a tricky question but simple question. Okay, so this was scurvy. Now next question was also a clinical and image based question in which a 20-year-old male presented to the orthopedic clinic with a complaint of progressive swelling on his wrist for the past 3 months. Okay, for the past 3 months. The X-ray and the clinical picture is shown below, which is the most likely diagnosis. So clinical presentation, here you can see a photograph of wrist की swelling was given and a picture like this of the distal end radius में this lesion was given, and here you can see this lesion is your soap bubble appearance वाला. अब इविंग सार्कोमा नहीं है बिकॉज इविंग सार्कोमा पेल्विस में होता है, एंड अगर होगा भी तो इट इज एट द डायफाइसिस. ओके, सो ये चला गया. ओके, now chondrosarcoma, osteochondroma and giant cell tumor. Osteochondroma में you will have that these calcified spicules and mainly in the leg bones, and the chondrosarcoma में also the presentation will not be like this. It is a typical presentation of the giant cell tumor क्योंकि ये दोनों ही एपिफाइजियल नहीं होते हैं. एपिफाइसिस में एक तो जीसीटी होता है एंड एक कॉन्ड्रोब्लास्टोमा होता है जो ऑप्शन में ही नहीं था. ओके, so GCT or osteoclastoma. So the answer was GCT. Very simple, and we have discussed this so many times, and मैंने हमेशा बोला है कि bone tumors में you will get one question definitely, and here was it. And उसमें भी I told you कि GCT सबसे important होता है, followed by the osteosarcoma and the Ewing sarcoma. So very important is your GCT. Okay, so इस पे question आ गया है. Now next question was a 25-year-old male presented to the OPD with complaint of chronic pain in the back and morning stiffness at joints for the last 3 years. The patient is taking treatment with local quacks for the same. Recently, the patient develops bilateral heel pain, which is the most likely diagnosis. So, यहाँ पे जो मैंने आपको लॉजिक बताया था कि एक या दो बहुत टिपिकल चीजें मिल जाएगी एंड उससे बहुत ही सिंपल डिजीज का डायग्नोसिस होगा. ज्यादा ज्यादा दिमाग नहीं लगाना है. ओके, सो 25-year-old मेल, क्रॉनिक पेन इन द बैक एंड मॉर्निंग स्टिफनेस. एंड इसमें एक और चीज लिखी हुई थी दैट द मॉर्निंग स्टिफनेस इज मोर देन 30 minutes and the patient is taking treatment, यानी chronic condition होती है, and there is recently bilateral heel pain. So ankylosing spondylitis, yes, हो सकता है because age, sex, backache, morning stiffness and bilateral heel pain, yes, हो सकता है because it is a systemic diseases. Pot spine, no, because there is no history of fever or anorexia. इस टाइप की कोई हिस्ट्री नहीं है infectious. ओके, प्रोलैप्स इंटरवर्टिब्रल डिस्क ऐसा हो सकता है बट there is no neurological signs or no neurological pain in bilateral or unilateral lower limb. Muscular pain, yes, तो अब इन दोनों में है. Now the condition here favors ankylosing spondylitis, so the answer is ankylosing spondylitis. Why not muscular pain? सबसे पहले it is very vague. ओके, सो वेरी वेग है तो मस्कुलर पेन जनरली ज़्यादा स्ट्रेचिंग या एकदम से ज़्यादा एक्सरसाइज करने की वजह से या विद पोस्चर बहुत विच हैव अ हिस्ट्री ऑफ long term sitting in front of the laptop or sitting on the chair or a shopkeeper. So these are the history which should be given in the muscular pain, and also it is a very vague kind of option. So generally ये नहीं होगा आंसर. So the answer will be the ankylosing spondylitis. Very important. I have told you कि आर्थराइटिस में तीन चीजें सबसे important है. The difference between rheumatoid and the osteoarthritis and your ankylosing spondylitis, very important. And ankylosing spondylitis पे इस बार 2 questions आए थे. Okay, so the first question was this, and the second question was a 30-year-old male sees same age group and male present because ankylosing spondylitis males में ज़्यादा common होता है, presented to the OPD with the X-ray as shown with redness in the eyes. On examination there was reduced chest expansion, which is the most likely diagnosis, एंड यहाँ पे ये जो साइन है, इट इज अ बम्बू स्पाइन टिपिकल ऑफ एनकाइलोजिंग स्पॉन्डिलाइटिस विथ this white line which shows complete fusion, and this is called as the dagger sign. Okay, this is called as the dagger sign. Very easy and discussed so many times in a rapid revision and various videos and questions also. So answer was ankylosing spondylitis. Systemic diseases तो urethritis, iridocyclitis, knee arthritis with reduced chest expansion. Okay, these are all pointing towards the diagnosis of the ankylosing spondylitis. Okay, very important and very easy. Now the next question was also a clinical based question, but it was a big question without any image, so इसको आपको ध्यान से पढ़ना था. And what is the question? A patient after a history of trauma presented with fracture of humerus having multiple fragments. On examination, there is decreased sensations on the lateral aspect of the forearm, and the patient is unable to flex the elbow and do the supination, which is the most likely nerve to be injured. Okay, so बहुत अच्छा क्वेश्चन है, गुड क्वेश्चन बट इजी ऑल्सो. ट्रॉमा है, ह्यूमरस का मल्टीपल पार्ट कम्यूटेटेड फ्रैक्चर है, सो देयर इज डिक्रीज सेंसेशन इन द लेटरल एस्पेक्ट ऑफ द फोरआर्म, अनेबल टू फ्लेक्स एंड सुपी. सो एक्सिलरी नर्व में तो यहाँ रेजिमेंटल बैच साइन होगा एंड डेल्टॉइड पे होगा, सो यहाँ पे लेटरल एस्पेक्ट ऑफ फोरआर्म एंड सुपिनेशन से इसका कोई लेना देना ही नहीं है, सो इट इज नॉट द आंसर. द अल्नर नर्व मीडियल साइड में होता है सब कुछ. Okay, so it is not the answer. अब बचे दो, the radial nerve and the musculocutaneous nerve. Most of the students have ticked radial nerve, but it is not the correct answer. The correct answer is the musculocutaneous nerve. Why? क्योंकि रेडियल नर्व लेटरल एस्पेक्ट ऑफ द फोर आर्म को करती है, यस करती है. सुपिनेशन मसल सुपिनेटर्स को सप्लाई करती है, यस करती है, बट रेडियल नर्व डज नॉट फ्लेक्स द एल्बो. एल्बो का फ्लेक्शन इज डन बाय द बाइसेप्स. ओके, ब्रेक क्या है, एल्बो का एक्सटेंशन इज डन बाय द biceps brachii muscle. Very important, the elbow extension is done by the biceps brachii muscles. And if you remember, the musculocutaneous nerve is continuing as lateral cutaneous nerve of forearm. Okay, so that's why the answer is musculocutaneous nerve. Very good question and easy also, बस ढंग से क्वेश्चन पढ़ना था. That flexion of the elbow, say the diagnosis is towards the biceps brachii and also fracture of the humerus with multiple fragments. Okay, so good question. Okay, now another very good clinical scenario based question. It was more of an excluding kind of question, and question on osteoporosis. Okay, so osteoporosis very important topic tha. So the history was given as of a old age 55-year-old female patient presented to the OPD with complaint of chronic lower backache. The patient has history of wrist fracture by trivial trauma 2 years ago, and recently DEXA scan was done and the score was -2.5, which is incorrect. So in सब से the diagnosis जो बन रहा है, that is very simple, that is osteoporosis. अब ऑस्टियोपोरोसिस के बारे में इन चार में से जो चीज गलत थी वो आपको पता लगानी थी. ओके, सो द फर्स्ट ऑप्शन वाज कि द कैल्शियम डेली डोज शुड बी 1200. यस, नॉर्मली 800 अराउंड होती है, बट इन ऑस्टियोपोरोसिस you give increased calcium dose, so yes, this option was correct. Oral vitamin D3 and oral calcium both should be given simultaneously. Yes, दोनों साथ में देते हैं. Teriparatide is always started before starting bisphosphonates, and fourth was bisphosphonates not given for more than 1 year. इन दोनों में ही confusion था. So bisphosphonates is not given for more than 1 year. It was also correct option because we have read कि bisphosphonates लंबे टाइम तक देने से you have increased chances of fracture. ओके, सो बिस्फॉस्फोनेट्स 1 साल से ज्यादा नहीं देते हैं. नाउ व्हाट इज टेरीपेराटाइड? टेरीपेराटाइड इज अ पैराथॉर्मोन विच have a bone forming effect used in the treatment of osteoporosis, but it is second line. याद रखना, first line and the treatment of choice is always bisphosphonates. So बिस्फॉस्फोनेट स्टार्ट करने से पहले टेरीपेराटाइड देंगे नहीं, पहले बिस्फॉस्फोनेट स्टार्ट करेंगे ऑलवेज. सो थोड़ा सा कॉमन सेंस यूज करते हैं तो ये ऑप्शन, ये आंसर यू वुड हैव क्रैक्ड वेरी इजीली एंड आई एम श्योर कि सबने यूज किया होगा. सो द आंसर इज that teriparatide is always started before starting bisphosphonates. This is the the incorrect option amongst the following. So this is the correct answer. Okay. Now another question was there in which a history was given with some serum values of the following things. A child presented to the OPD with chronic bone illness and the patient, ये बहुत important चीज दे रखी थी उसमें, that the patient shows no improvement with regular vitamin D3 supplementation and पैराथॉर्मोन, फॉस्फेट एंड कैल्शियम की सीरम वैल्यूज दे रखी थी. सो पैराथॉर्मोन की नॉर्मल सीरम वैल्यू जो होती है इट इज बिटवीन 30 और 10 to 55 पिकोग्राम पर ml. फॉस्फेट नॉर्मल इज 3.4 to 4.5 mg per deciliter and your calcium is between 10 to 11 mg per deciliter. So calcium is normal, phosphate is decreased and parathormone is normal with no improvement with regular vitamin D3 supplementation. So vitamin D dependent rickets कैंसिल, हाइपरपैराथायरॉयडिज्म कैंसिल. अब ये दो ही बचे इसमें से, अनीमिया तो ऐसे ही फिलर टाइप का ऑप्शन था. सो द आंसर इज हाइपोफॉस्फेटेमिक रिकेट्स बिकॉज phosphate level is also low here, very low. So very easy answer. सिर्फ आपको ऑप्शन एक्सक्लूड करके आंसर क्वेश्चन करना था. सो दीज वर द रिकॉल क्वेश्चंस ऑफ द ऑर्थोपेडिक्स ऑफ नीट पीजी. एंड इसमें अगर अपन इसको एनालाइज करें सो 8 questions are there. Okay, and in 8 questions में से 5 were very easy, moderate में 2 थे and for me tough या moderate भी 3 मानूंगा और the tough one or the difficult one was only 1. Okay, and they were straightforward questions, but as we have discussed ki clinical based questions, x-rays and the images, मतलब almost डायरेक्ट वन लाइनर्स भी थे तो उसमें भी इमेज या कुछ दे रखा था. तो वेरी इजी क्वेश्चन फ्रॉम द ऑर्थोपेडिक. एंड सबसे बड़ी बात, अगर किसी ने ऑर्थोपेडिक्स के लिए प्रिपरेशन नहीं भी करी है तो भी जितने भी क्वेश्चंस थे ऑर्थोपेडिक्स के, यू ऑल हैव रेड देम इन योर एमबीबीएस during your MBBS, during giving your university or prof examinations. तब ये आपने सारी चीजें पढ़ी है. So there was nothing in depth, बहुत ज्यादा basic concepts and basic clinical relation were there. Very easy paper from the orthopedic side. And अगर अपन in general भी बात करें, so all questions were from topics which were important already and सारे important topics में थे different subjects में. कोई भी क्वेश्चन पढ़ के आपको ऐसा नहीं लगा होगा कि यार ये मैंने कभी नहीं पढ़ा आज तक लाइफ में. Okay, all questions were like this. So all questions were attemptable. सब attempt करने लायक questions थे. So at least 190 तो सबको ही attempt करने थे. And that was moderate level. So as we compare with the last year, तो last year the clinical questions थे लेकिन proportion में देखे तो इतने ज्यादा नहीं थे, one liners ज्यादा थे, but the number of questions and the amount of the hours were less. So उसकी वजह से क्या हुआ था, that question was tough, sorry, that paper was of the moderate value. अब यहाँ पे ये पेपर भी moderate है because the questions were more lengthy and more clinical based. ओके एंड जिसमें आपको थोड़ा सा कोरिलेट करना पड़ रहा था, थोड़ा सा कॉमन सेंस या थोड़ा दिमाग लगाना पड़ रहा था. बट टफ इसलिए नहीं था ये पेपर बिकॉज देयर वर ओनली 200 क्वेश्चंस फॉर 3.5 hours एंड यू हैड एम्पल टाइम. सो आई थिंक the cutoff will obviously get increased and the competition is very tough this year because number of questions कम थे. ओके एंड ऑब्स गायनी में के क्वेश्चंस इस बार ज़्यादा थे. सब बच्चों ने मुझे यही बोला है कि सर ऑब्स गायनी was super important this year, there were many questions. So ठीक है, हो गया, अब जो हो गया it is very good. Now you need to focus on your party. Okay, let's do party tonight. सब अपने अपने I think सबको अभी पार्टी करनी चाहिए. It is over, just forget it, just do fun and relax yourself for around 1 to 2 months. ओके एंड आई होप सबका ही अच्छा हुआ. एंड जितने भी मैंने अराउंड 10 to 15 ऑफ माई जूनियर्स एंड ऑल से बात करी एंड ऑल ऑफ देम सेड की वॉज पेपर वॉज इजी एंड हमें इस बार लोड नहीं आ रहा बिकॉज यस पेपर अच्छा हुआ है. ओके सो रिलैक्स, पार्टी. अब नहीं सोचना पेपर एंड ऑल के बारे में. कीप असाइड योर बुक्स फॉर 1.5 months, जस्ट डू पार्टी. और जो नेक्स्ट ईयर के लिए प्रिपेयर कर रहे हैं, जिन्होंने इस बार एग्ज़ाम नहीं दिया है, उनको अब पढ़ाई लेकिन शुरू कर देनी चाहिए. और उनको कैसे करनी चाहिए, फॉर दैट आई हैव अ ओरिएंटेशन और द स्ट्रेटेजिक सेशन tomorrow at YouTube live, so I will see you there. So I hope ये session आपको अच्छा लगा होगा. And if you have any other information regarding the orthopedics question or some add-ons you need to give in the history, you can contact me. Okay, and I hope all are doing well. और आज तो सभी अच्छे होंगे. So enjoy, and if you like the video, please like, share and subscribe using this code of mine to get extra 10% off. Okay, so bye bye, party, enjoy, stay safe.